Okay, good afternoon, everyone. Welcome to our webinar. My name is Jenny Dunn. I'm the Director of Marketing at Mary Crowley Cancer Research. And today we are so thrilled to bring you our friend Isabella Ferrari from Doherty Nutrition. Isabella is going to be sharing with us today all about nutrition challenges during cancer treatment. And we're really grateful to have her intelligence on this issue. Isabella is a CSO certified specialist in oncology nutrition. And I won't delay too much, Isabella. I'm going to go ahead and turn it over to you. Everyone, though, go ahead and put any questions you have for Isabella in the comments, and we will get to as many as we can at the end of the presentation. All right, Isabella, you are on.
Awesome, thank you. This is my first webinar and live thing, so we're trying to know where to click and things. So bear with us while we figure that out. I think you can see my screen here. I'm just gonna make it bigger. Like Jenny said, I'm a dietitian certified in cancer nutrition. That just basically means that I help patients even for like cancer prevention, during cancer treatment, and then for cancer survival, and in anything that involves nutrition of any kind. So today we're going to specifically talk about 5 different ways that you can help your cancer symptoms, or basically 5 different symptoms and ways that you can help those cancer symptoms that happen during treatment or just because of your cancer. So we're going to talk about what those symptoms are. Usually I pick the ones that people experience the most common ones, and then what are things that you can do from the nutrition standpoint to make sure those symptoms are a little better. So first, let's see like why nutrition is important throughout the cancer diagnosis. So again, even before, during, and after your diagnosis, nutrition should be key. So a good nutrition during treatment can improve the tolerance to your treatment, meaning that you are able to get more treatments and less like delays in that treatment. It helps preserve lean mass, which can help you be more mobile and independent during treatment. There's a lower chance of recurrence, and that would be, after remission. If you follow specific dietary guidelines, you can lower your chances. Also, nutrition gives patient a lot of control, right? Usually we have the doctors telling us what to do all the time, and they offer medications and treatments, and we just do that. With food, the patient can have control as to what they're eating and what they're putting into their body. All the cells in our body need nutrition, right? So that's specifically like the cells that are going to help us fight the cancer. And then it helps us.
I'm so sorry to jump in, but we actually can't see your screen. Are you sharing your screen? Just to check. This is going great. I love hearing you, but just want to check.
No, I thought you were. Thank you for letting me know. Let me go back to that. Share screen. I thought I was sharing it. There we go.
There we are. Perfect.
That's better. So this is what I was talking about, which I was telling. So this is in writing what I was talking about before. Nutrition also helps you keep a healthy weight, right? So that during treatment, that's very important. Sometimes doctors, like I said before, they don't want to give treatment if your weight is too low or if you're too weak to receive treatment at that time. And it can also decrease the side effects from treatment. And that's the one that we're going to specifically talk about today. So these are the most common symptoms during cancer and cancer treatment. And if you're a cancer patient, these are things that you have probably experienced. If you've taken care of someone that has had cancer, then this is also things that you might see. So anorexia and fatigue, early satiety, diarrhea, dysphagia, nausea, vomiting, and taste changes. So we're going to talk about each of them, and then 5 different ways that you can kind of help each of these with what you eat. So anorexia and fatigue is basically the lack of loss of appetite for food, meaning that you just don't want to eat, and then the fatigue is just feeling overtired and with low energy. So I kind of grouped both of these together because you kind of don't want to eat because you might be too tired. So these are the ones that are together. So 5 things that we can do to make sure, we're getting food in despite having these feelings of being too tired or not wanting to eat. So the main thing is small, frequent meals. We're so used to eating like 3 big meals and maybe snacks in the middle. In this case, we want to be offering way smaller meals, sort of like snack-sized meals, just often during the day, every 2 hours, trying to eat something. And we want to make sure that wherever we're eating is a densely nutrient-rich food, right? So something that's going to actually give us nutrition every 2 to 3 hours. Instead of things, for example, like chicken broth or things like that, that can be something that you want at that moment, but that's sometimes that just fills up your stomach with things that are not giving you a lot of nutrition. We want to eat on the clock rather than waiting for hunger cues, just because basically those hunger cues are not there because we have, the lack of appetite. So a lot of the time, this is good for caregivers too, to have a set timer and be like, okay, it's time to offer something. It doesn't mean that, the patient's going to want to eat at that time, but it's a time to offer the food at that moment and be like, hey, it's time to eat. Also viewing eating as part of treatment, right? The same way that you have to get your chemo and the same way that you have to take your drugs, you also have to eat to make sure that these drugs kind of can do what they need to do. Use medical nutrition beverages. So those are basically high calorie, high protein drinks that you can drink, and it depends on a lot of things, which one is the best one for you. A dietitian can help you figure out which one's the best for you, but that's a good one that is this like nutrient dense food, right? Like you can have a lot of calories, a lot of protein in just a small volume of meals. And keep non-perishable snacks at bedside or handy. Meaning that, if the patient wants something, they can just grab it and not necessarily have to wait for someone to bring the food, or they don't have to get up and do the work of trying to get food, because that would just make them more tired and then not wanting the food. So just having things that the patient usually likes and likes to snack on, just having them at bedside. Diarrhea, great word, but it's very, very common in patients going through treatment. And diarrhea is basically defined as loose, watery, and possibly more frequent bowel movements. Usually more than 3 bowel movements a day is what we consider diarrhea. Also, diarrhea for some people might look different than from diarrhea from other people, depending on what your baseline kind of bowel movements are. So 5 tips for that. And I think this is the most important one, is we want to keep a food symptom log to identify the problem foods, because it might not be the same for everyone. It's not like I can tell you like, oh, beans cause everyone to have diarrhea or bloating. It depends on the person. So just keeping a log of like what you ate and when you had symptoms, it's a good thing to just have, so you can go back and like find like, oh, both days that I ate potatoes, I had diarrhea. So it's just good to know what's causing you issues. In general, keeping a diet that's low in fat, low in fiber, low lactose, and low gas producing foods. Oh, it says spots there, I apologize. It's also a good thing because these are the most common ones. But again, it might not happen this way to everyone. We can use bulking agents such as pectin and soluble fiber foods. This can help just make the diarrhea or the stools a little more solid, or like I said, so like bulked. We want to avoid sorbitol and sugar alcohols. The same with just regular sugar. That just makes our body want to dissolve that and bring more water in, that at the end is going to come out. So those things can cause a lot of diarrhea. And then you can ask your doctor about including probiotics. Sometimes that's good to restore our microbiome and restore the good bacteria in our gut that might help us make this diarrhea better. Then we have for nausea and vomiting. We most know what this is, but it's just, feeling sick and you have an inclination to vomit or actually want to vomit. Some people have this right after treatment or even during treatment or during that same session. And sometimes that just leads to eating less, being more weak, and what we talked about, maybe losing or not being able to finish, one of your chemo sessions, for example. So it's the same way with anorexia and fatigue. Small frequent meals, 5 to 6 meals a day. And that kind of makes sense, right? Like if you eat a huge big meal, even if you're not going through cancer, you still kind of might feel a little bit nauseous, right? So just eating small meals that you're going to be able to tolerate that are also dense in food can help you a lot with this. Limit exposures to food smells or like preparation areas. When we're in the kitchen and we smell those kinds of things, it can just provoke that feeling of nausea. This is the same thing we recommend for pregnant women. Just avoid smells that can make just the nausea worse. So if you have someone taking care of you, they can be preparing the food somewhere else and you can be in the room without necessarily having to smell that. If you're the one cooking, we want to make sure we have the fan on, so the fan on top of the oven on. If you have a fan, or open all the windows that you can, open all the doors to make sure that whatever smell comes up from your cooking is not staying there. Try eating the food cooled down. The warmer the food is, the more smell it's going to have, and that's just going to make the nausea worse, which sounds kind of weird, eating, cold rice or cold meat, but if that's the only way that you're going to be able to keep it down, then we want to try that. We want to drink our liquids in between our meals. If we have it with our meals, that might just make the volume of what we're taking during that meal a bit much for us to be able to tolerate that meal. So if you drink in between the meals, you make sure that during the meals, you're actually just getting the food and not filling up with things that, again, can cause that nausea or that vomiting. We also want to rest with our head elevated for 30 minutes after eating. That's just going to help the food kind of go down and not stay up here, but it would make us vomit a little bit more. Again, these are only tips from the nutrition standpoint. Your doctors can always prescribe anti-nausea meds that can help, but this gives you control of things that you can do extra from the medications, or while you wait for the doctor to prescribe you, that medication also works. So dysphagia. This usually happens with certain kinds of cancer. It's basically just difficulty swallowing. This can happen with cancers of our mouth, our tongue, our head in general. So our head and neck cancers can happen, our lung cancers can happen too. And this is just difficulty swallowing. You have a hard time bringing the food down. So things that you can do, we want to use good posture, kind of the same thing that we talked with nausea and vomiting. We want to sit up to make sure we prevent aspiration. That's one of the main complications for dysphagia. Not only that you're not eating enough food because you can't swallow, but if you have trouble swallowing, you can aspirate food and that would go to your lungs, and that just creates a whole other complication that we don't want to even think about, right? So just having good posture while eating, meaning we don't want to be eating laying in bed. We want to sit up, have a prop to sit us up, avoid distractions while eating. And this happens with all of us, right? If we're just eating and we're not paying attention, we might start coughing and be like, oh, what was that, right? If we're paying attention, chewing our food enough so that, we're having it the right texture for it to go down, it's a great thing. And that's just, we can do that while we avoid distractions while we eat. We also want to encourage double swallows. That just to make sure that the food actually goes down. And another way of doing that is just talking after you drink or talking after you eat some food. Again, just making sure that the food actually went down the right pipe. Avoid using straws, because sometimes they can leave the food at the back of the mouth and can make aspiration even worse. Okay. And the most important one actually is consider a speech consult. They can tell you what texture you'd be better off with. And once us dietitians have what that texture is, we can help create, ideas for meals that have that texture that are going to give you all the nutrition that you need. And then taste changes. This is fairly common just because, sorry, that was weird. And then we have taste changes again, which can be just because of the chemo. So with taste changes, people have different changes, right? Some people have no taste, some people just have an off taste, some people have a metallic taste, or some people have a bitter taste. It just depends on the person, and it depends on what you're tasting, what you should change your food to be like, right? So for example, if the food has no taste, and this is really, really common, we want to make sure that we're cooking our meals with lemon, pickles, hot sauce. Hot sauce is great. It just gives the food some kind of extra flavor. And for some people, it might be super spicy, but for someone that, has this issue for taste changes, they might think that it's totally fine, and it's great if it's going to get them to eat more food. So that's if you have no taste. If you have an off taste, we want to drink water or tea or ginger ale or fruit juices to club soda to kind of cleanse even in between bites. That can help. It's very off-putting for a lot of people to try food and it having no taste. So one of the things is like I sometimes encourage people to avoid their favorite foods because I don't want you to create like, oh, I can't even eat my favorite food, or it doesn't taste good anymore, it's not your favorite food anymore. So this would be a great time to include things that you normally don't eat, and you might find a better taste with it, right? So it's just about trying different things, even if you think you're not going to like it. Your body can be like, oh no, I actually like this right now, and this tastes is good. Some people might have a metallic taste, and that's good. You can use plastic silverware, just because if you use regular one, it can make the metallic taste even worse. And sucking on lemon drops during the day can also help change that. Some people have bitter taste with foods, and we can add sweeteners to those fruits. And even adding sweeteners to things that should not be sweet, even adding sweetener to rice, adding sweetener to meats, just to things that should not be sweet, it just brings out the flavor, right? Same way that we like add salt to cookies that are supposed to be sweet because it brings out the flavor. We want to do the same thing, and it's just about trying new things and what's going to work for you. The other thing that's great is you can freeze fruits and eat them as frozen treats. That's going to calm down your taste buds, and it's going to give you, some kind of nutrition also while you're enjoying these frozen treats. So this was all, super fast, super quick information that you guys can use anytime. But you can always, go talk to us, a dietitian. If it's me, that's even better, because again, I know about oncology. So this is the info as where you can make an appointment with me and just talk about more of this. The one thing about nutrition, especially during cancer treatment, is that it's very specialized and very individual thing, because one thing that might work for someone might not work for someone else. And it's just a lot about trial and error of figuring out what's actually gonna work for you. So now it's the time where we go back to questions. So I think I can give Jenny control, right, Jenny?
Sure. If you just want to end your sharing. Thank you so much, Isabella. That was so much great information for us. I do have a few questions that were submitted on various channels. So I think a lot of them are around just the process of working with a dietitian. Many people may not have thought that was even an option for them or haven't approached that before. What is the process like for a patient when they first come in with you?
Yeah, so most of the times patients can find us through their doctor, their oncology clinic, and they can send a referral and just work for me. Most of the times doctors do, refer to a dietitian when they've seen that a patient has some weight loss, or when they have a high risk cancer, like a head and neck cancer, that they know that they're probably going to have trouble eating. They do refer to the dietitian, and doctors honestly have so much to talk to cancer patients about, right? Like they have the medications and the medications for the medications, and then how often you're going to come, right? So they really don't have time to talk about how you're going to nourish yourself during treatment. So, and that's why I tell patients, I was like, I have a whole hour. Like, what do you want to talk about? Let's talk about food. So yeah, sometimes people just call to the office and make an appointment with me. And usually what we do is we have an assessment the first time, where I just like ask the patient a lot of questions about what are their goals. Specifically for cancer, most of the times the goals are just keeping weight, and being able to continue treatment. And we see them even on a weekly basis to just trying new things, making sure they're not losing weight. Sometimes patients even have, or get to the point where they need tube feeds, and that's also something that we can manage, how to give you nutrition through your tube feeds. So yeah, that's, doctors can refer, or they can come find us. Most health insurance cover our services. It would just be, trying to figure out what the best way is, but patients can just come see me regardless.
Yeah, that was another question that came in, is does insurance generally pay for a consultation?
It depends on the insurance. We on our side try our best to have insurance cover for our services. It depends on the insurance. Usually if a patient has diabetes or renal disease, it is covered, but some private insurance just cover it just because. So it's a whole insurance situation that we're trying to work through. But yeah, most insurance do cover the services.
Right. Okay, great. And then another question that came is, why is it, and you touched on this a little bit earlier, but we'd love to hear more about why it's important to see an oncology specific dietitian.
Yeah, and I think that answer might be the same for like any kind of dietitian that has any kind of specialty, because there's dietitians that help with weight loss, there's dietitians that help with kids, there's dietitians that help with eating disorders. So it's such a wide range of things, and it is such a wide range of things because food is part of everyone's life, right? And we're all different. So just being specialized in oncology, in my case, it's more about how you can get more in little. That's kind of how I like to talk about it. Like, how can you get the most amount of food and nutrition in the least amount of volume that you can? Because usually cancer patients don't want to eat that much, or don't have the appetite. So that's one thing. And again, nutrition, like you saw, it can also help with symptoms. Like what you eat can help you feel better. And again, and I always say this, like the only reason you and I are here is because we ate enough when we were kids, and we ate enough growing up. That's literally how I explain it. So if we do not eat enough, we wouldn't be here. So that's how I like to explain it for patients. And then again, my advanced practice involves 2,000 hours of working with oncology patients, and then I have to take a test every 5 years. So it keeps you on top of all cancer research, which is specifically important for this population.
Right. Thank you. That's such a great answer. And we have another question, which is, would you suggest meeting with a dietitian at the start of their treatment, or when these symptoms start to arise?
I'm of the train of thought of you should do it regardless, and even before, like when you're diagnosed with cancer, you should see a dietitian just to make sure we keep your weight, right? That's the main thing. That's the main goal that I have for most of my patients, just keeping your weight. And we also don't know how patients are going to respond to treatment. Some people might think like, no, I'm going to do great, I'm going to eat everything and it's going to be great, but we don't really know. And the symptoms can vary a lot with a lot of people. So just seeing so that we have our baseline, and then seeing how people respond or react to treatment would be the way of like how we do the follow-up, and be like, okay, what did you feel this week? Let's try this. How was this week? Let's try this. Needless to say, there are cancers that are higher risk than others. For example, cancers like head and neck, gastric cancer, those are higher in the nutritional risk score than, for example, breast cancer. But both of them should meet with a dietitian for sure. For example, for breast cancer, it's very important to meet with the dietitian after you finish your treatment, because one of the things that can help prevent recurrence of cancer can be a healthy lifestyle. So that's something that you don't only have to work with the dietitian before your diagnosis, but even after your diagnosis to make sure that, we can help prevent that recurrence.
Yeah. And, you just actually got that question, which is, are there any tips to diminish the probability of recurrence? And this person was asking specifically about prostate cancer, but I think we can open that up in general. Are there things people can be doing once maybe they hit no evidence of disease, or they're finishing up treatment and moving forward to prevent recurrence?
Yeah, there's a lot of things, and there's also a lot of research happening, which is also pretty exciting. But for sure, like the two things that are the most important ones would be, staying physically active is one of the main things that can help a lot, regardless of your weight at that point. Just staying physically active is one of the ways that you can prevent recurrence. And then just having a healthy lifestyle, which includes a lot of things, right? Mental health, but food-wise, just eating enough fruits and vegetables and eating enough fiber during the day would be the main thing. And there are specific recommendations for specific cancers. For prostate would be keeping a healthy weight, a healthy lifestyle, and staying as active as possible.
Great. How often should people visit a dietitian if they're looking to do something like this, or is it very variable?
It varies, but usually for cancer patients, in my experience, it depends on what their treatment looks like. How often are they getting chemo? How often are they going to the doctor? What kind of chemo they're on? What kind of cancer they're on? For most of my high risk, sometimes we even see patients like twice a week, sometimes once a week if it's something that is just like maintenance. So if you're going, trying to have diminishing your chances of recurrence, that's something that we can do every 2 weeks. So it depends. Sometimes twice a week, sometimes once every 2 weeks, or once a month. But I think for some people it helps a lot having someone to talk to about food, because that's our day to day, especially for cancer treatment. Like, you're going to eat every day, right? You're going to have to eat something every day, and they don't have people to talk to them about food because the doctors just talk about medications and drugs, and no one really to talk about food. And like I said before, I love food and love talking about food. So yeah, it can be however people want.
Wonderful. Thank you. Thank you so much. This was such excellent information for us. Isabella, can you remind us where we can find you and Doherty Nutrition?
Yeah, so Doherty Nutrition, we like to say it's pronounced Doherty, like a door and a T. But I can, we can put in the comments also how you spell it, but we're on Instagram as Doherty Nutrition, Facebook also Doherty Nutrition. And I can share my screen again for a minute so that if anyone wants to write down kind of our numbers and our address, they can write it down.
Yeah. Please
Okay,
do. Thank you. Thank you so much for this great information. Thank you all for watching today. You can find Mary Crowley at www.marycrowley.org and on pretty much all social platforms. Thank you for watching. Stay tuned in the future. We're going to release a Spanish language version of this presentation, and we're looking forward to bringing you lots of more exciting content. Thanks for being here. Remember that you can always find out more about our clinical trials by visiting our website or looking it up on our app. Thank you, Isabella. Thank you all for being here, and we will see you next time.
Bye.
Bye.